As I mentioned earlier today, the Center for Disease Control announced that it is extending the nationwide mask requirement for public transit. That was set to expire this coming Monday. This now will go until May the 3rd. Now, this is the same CDC that 2 weeks ago decided that it was about time to terminate Title 42, which was put in place to protect against the spread of COVID at the southern border. So is the pandemic over on our southern border, but still active everywhere else in the U.S.? Joining me now to talk about this and more is Congressman Markwayne Mullin. He serves on the House Energy and Commerce Committee, including the Subcommittee on Health. He represents the 2nd Congressional District of Oklahoma. Congressman Mullin, welcome to Washington Watch.
Thanks for having me on.
So what's your take on the CDC announcement today?
Well, it's hypocrisy. You have the Democrats on one hand claiming that the pandemic is winding down, and so they no longer need Title 42, and at the same time they're extending the ban on travel restrictions and making you wear a mask, which is you're not even having to wear a mask anymore in Washington D.C. or in the Capitol, and they're also asking for $15 billion of taxpayer dollars to continue to move towards COVID relief. So it's all about positioning themselves by control, and they control by fear. So if they can control you by making you wear a mask, also control you by the way they think you're going to vote.
But the law requires for the administration to put in place such restrictions like this, they have to have justification. What is the scientific support or justification for this extension, given that we're seeing hospital rates decline? As you pointed out, most every place is moving away from these pandemic era restrictions. What's the justification for this?
Well, Tony, it's all about following the science, remember? But in this case, it's about following political science. It doesn't really have to do with following science when it's based on anything except what they perceive is good for them. The transportation area is the only place we're seeing the mask mandate stay in place because it's the mass movement of individuals. Nothing about it makes any sense. It doesn't make any sense while you're sitting on a plane and you can drop your mask, which I'm on 4 or 5 planes a week, where you can drop your mask to eat and drink. And I guess for some reason you can't spread COVID while you're eating and drinking, but you got to have it up the rest of the time. There's no longer 6-foot distancing put in place. It's 100% about optics, and that's all it is. It's about optics, and I believe it's about control too, because they have openly admitted to it that they're trying to ease the restriction out because they don't want to cause panic. Well, who are they causing panic by? Because if you poll it, most Americans at this point, over 70% Americans at this point, they don't want mask mandates. So you're punishing the 70% for the 30% that feel unsafe. Well, that 30% can choose to wear a mask themselves if they want to without a mandate. They can also choose not to travel, but that's not how this administration works. This administration works by pandering to the few because they're the ones that are outspoken.
I want to shift gears to move to a piece of legislation signed into law yesterday by Governor Stitt. This would provide full protections for the unborn. And of course, the left, not surprisingly, is up in arms over this. But quite frankly, this is what states have been doing. States increasingly over the last decade have been pushing laws to protect the unborn. What do you make of the developments there in Oklahoma that will protect the unborn, even to the point of restricting chemically induced abortions?
Well, this is about saving people's lives. We're talking about saving 4,000 lives the first year this bill goes into place. I'm a father of 6, and we have been very blessed to have, as I say, 3 children that the Lord blessed us with biologically, and 3 children that the Lord blessed us with by allowing us to bring them into our lives. And so we're proud parents of 3 adopted children too. Thank the Lord that the mother that gave birth to those children did so, because we're able to love them and they love us back. And so when we're talking about a life, that's what we're talking about here, saving lives. This isn't about stopping abortion. This is stopping the killing of a child. As a child, my wife and I, we worked 7 years, literally tried for 7 years to have children. And we got pregnant one time on our own, and we were extremely ecstatic about it, Tony. And unfortunately, we had a late term miscarriage. And that wasn't just a miscarriage to us, that was a death. Because when we went in the hospital and we didn't hear the heartbeat when we had to go in for a checkup, that was devastating. It was a lot worse even on my wife because her body had already started going through a lot of changes than just me, but it was hard on both of us. And for someone to say that that's not a child, to see what California is trying to propose now with the law they're trying to pass, it makes you sick to your stomach. And so when our state stands up and says we're going to protect a life here, we're not going to allow this to happen, that makes me proud to be from Oklahoma. And I'm proud of our legislators for passing this legislation in the House and in the Senate and in Oklahoma City, and putting it on the governor's desk, and the governor that's willing to sign it.
Yeah, I have to say, I too share in that, having grown up in Oklahoma, connected now to two very red states, Oklahoma and Louisiana. I think, of course, Oklahoma is very red.
We're the reddest, yes.
Yes, you're the reddest. I understand that you don't have to rub it in, but we're close. We're not far behind. I have to applaud the states for taking the initiative. Of course, we have the Dobbs case before the United States Supreme Court, anticipating a decision in that very soon. That coming from Mississippi, where legislators were willing to do what they were told they couldn't do. And so I think what has happened is we've seen this barrier, so to speak, has been broken, and more states now are, I think, reflecting the will of the people that put them in office.
Well, if you really go out and explain abortion, especially late term abortion, overwhelmingly the American people are against it. And except when it comes to the life of the mother. And to me, that is a very personal decision that someone has to make. And I would tell you where my wife's decision would be, and I would tell you where I think our decision would be, but that's a very tough decision for a family to make in that case. So when you start looking at individuals that have to make these decisions that's in the state legislators, which once again, I commend them, which is why we need to really push state rights even more, which is why I love to see states stand up against the federal government and say, we have the right to do this. It's once again, it's about saving lives. Yeah. Can you imagine? I mean, and Tony, I know you're a leader in this. You and I have spoke before, but it's hard to imagine how many leaders that never had a chance to lead. How many leaders we have lost in this country because of abortion. Yeah, it's amazing to me because, as I said, I've got 3 young people that live with us because their mothers chose not to abort them, and they are loved and they are our kids. And I can't imagine having anybody else with us. And I'm telling you, those 3, as long as my other 3, all 6 are going to be leaders. They're going to be leaders in their communities, and they're going to be leaders in this country. And it breaks my heart to think how many we've lost. And so when the states stand up for this, I'm telling you, I commend them and I get excited about it, because where the federal government has failed, our states are taking back control.
Absolutely right. Congressman, I got to leave it there. Folks, stick around.